Here we have the human skeleton, where the most complex part of our body is the human foot, containing 26 bones, 33 joints, and more than 100 muscles, tendons, and ligaments. When the foot structure is in balance, then there is no abnormal forces acting on the foot. However, because of the closure of the sinus tarsi, the space in between the ankle bone and heel bone, all of a sudden we have an excessive amount of strain to these soft tissues as well as the joints. Eventually, the weakest link is going to give. Many people suffer with heel pain or plantar fasciitis. The plantar fascia is this big, long band of tissue that goes from the heel to the ball of the foot. The average person takes 10,000 steps a day. Eventually, these fibers start to rupture. That causes pain. So, as time goes on, the fibers keep getting worse and worse. And eventually, they just completely rupture, which then leads to many other problems. Conservative treatment usually does not provide the best solution. Now we have HyProCure, which is the internal orthotic to straighten out the foot, therefore taking the strain off the tissue. This is a minimally invasive procedure. A small incision is made right over the sinus tarsi. At this point, a guide wire is placed into the sinus tarsi. And then we have various trial sizers that are placed into the space to see what size stent is needed to keep this space open. The foot is put through a range of motion, and it's very easy to tell which is the most appropriate size. The great thing about this is that with every step taken, no matter what kind of shoe is worn, internal correction is being achieved. These stents have been used for over 5 years and are used routinely from children as young as 3 years old all the way up to 91-year-olds. We have patients with all kinds of activity levels, running marathons, playing basketball, etc., without any problems whatsoever. There's a long history of putting different devices into the sinus tarsi, but with the birth of HyProCure, this has been a revolution in this kind of technology. The HyProCure stent is quite simply just pushed into the space. The soft tissues grab a hold of the stent and it locks it into the sinus tarsi. After the procedure, patients are able to weight bear immediately. We can see that the HyProCure stent is completely different from any other sinus tarsi device on the market. The big change with this stent is that it locks deep into the canalus portion of the sinus tarsi. So this way the tissues are able to really grab a hold of the stent to prevent displacement. You can see how the HyProCure stent perfectly matches the anatomy. Once the stent's in place, we now eliminate the excessive strain to the plantar fascia, and for once these fibers then can heal, thus ending this very painful condition.